right. It's Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is the time I get to spend with you guys and answer all your urine and burning plastic surgery questions. And we can go from head to toe, from pre-op to post-op, and anything in between, including complications. It's always good to ask about that as well. All right. We're here at Pure Plastic Surgery today, and we're going to have just a little brief topic here today. And then after that, I am happy and ready to dive into all your questions. So today we are on Instagram, we're on TikTok, we're on YouTube, and I want questions from all of you guys, all right? Lately, TikTok's been winning. I don't know Instagram, I don't know what's happening, but the TikTok people have been super active, and I love that. I love that about you guys, all right? But what I want to talk about today was something that I introduced just before I left for the Thanksgiving break last week. And so I introduced that, and it just blew up. Everybody was asking about it. Everybody was wanting it. And so what was it? Well, I had just basically put together what I like to call the smart tuck. Okay. So it's basically, if this is your kind of run-of-the-mill tummy tuck, this is the smart tuck, right? This is like the next level tummy tuck, where it combines a whole bunch of certain elements to provide a beautiful, curvy, but also enhanced natural type of result. This is like the highest level of tummy tucks that you can reach, right? And so that's why it's called the smart tuck, because if you're going to get a tummy tuck and you're smart about it, you might as well get the smart tuck here, okay? So people were asking, like, they were looking at the photo, and if you want to look at the photo, let us know. We can put that up on our stories once again. But people were like, this looks absolutely fantastic. What is it? What makes it different? And, and there was a little bit of confusion about that. So the smart tuck is basically my own signature tummy tuck, okay? So what makes it different? Number one, I'm the one doing it, right? But it does have a few additional elements that I didn't used to include in my kind of regular tummy tucks, okay? And so while with the regular tummy tuck, we typically include some liposuction to the flanks. Now we're including liposuction to the flanks, of course, but also all the axillas and the waist as well. So it includes the entire, all the way from the armpit all the way down. And also, if you have a little bit of that excess fat right here, which I know it bothers a lot of women out there, it includes that as well. And the issue with this fat that's up here is that there's no way of getting rid of that in the gym. It won't go away. You can kill yourself in the gym, and that's not going to go away. So the smart tuck now includes lipo to the axillary area in the front, the axillary area underneath the arms, the entire flank, entire waist, to start to provide that nice curvy figure. But then on top of that, if you really want to kind of bring out that hourglass shape, we got to add some of that fat back, and specifically, we got to add some of that fat to your hips. So now we're including fat transfer to the hips, along also with all those lipo areas that we talked about. So you're going to get some fat transfer to the hips. You're going to get those nice, beautifully round, curvy hips, that tiny waist. Of course, we're going to be doing the skin excision. So it's basically a tummy tuck with curves, right? A tummy tuck with hourglass shape. We're not doing grandpa's old straight up and down tummy tuck no more, okay? So it's a tummy tuck with curves. Of course, we're gonna remove all the excess skin. And then, yeah, we're still doing that muscle, what we call muscle plication. Basically, we're putting together the muscles and we're strengthening the abdominal muscles. And in doing that, it's not simply, repairing, doing the muscle repair, but we're also doing like what I like to call like an internal corset. So this includes like an internal corset, okay, which also helps shrink in the waist. Okay, so we're shrinking the waist from the outside and the inside. Okay, so we have the internal corset as part of that as well. And then what is like one of the most important parts about the tummy tuck? Everybody knows, and I said it before, and I'm sure some of you can guess, but one of the most important parts about the tummy tuck is the belly button, right? That tends to be like the sign that someone's had a tummy tuck, is if they have a lot of scarring of the belly button, or the belly button doesn't look good, or it doesn't look natural. If it looks like too thin, like a little thin slit that goes up and down, I don't like that look. I like to kind of create a more natural kind of inverted U or oval shaped belly button. And then the key to that is not only the shape of the belly button, but also where you are placing the incision, because there is going to be a scar around the belly button. But what I like to do is I try to put that incision as tucked in as possible. So you have your belly button with your tucked in incision. When we tuck that incision, it's not so visible from the outside, right? So you have like that natural looking belly button. So natural looking belly button as well. And this is all done through our proprietary technique of what we like to call smart aesthetics, right? And it's actually trademarked. So smart aesthetics is when we don't do cookie cutter surgery, right? We tailor each procedure to your unique and underlying foundation, because all patients are different, right? We're not airline pilots. We're not on a plane, right? Like a Boeing, 787. They're all the same. Well, that doesn't work for us, right? Every patient is a little bit different, right? You have different ages, you have different BMIs, different height, different weight, different skin quality, different underlying shapes in terms of your skeletal foundation, right? Every single patient is just a little bit different, and so we have to take that into account in order to create a beautiful and enhanced natural result. Okay, because that is the bottom line. That's what we want to create. So moving forward, if you're thinking about a tummy tuck, you should definitely, you're smart about it, you should think about that smart tuck. Okay. All right. So now I am happy to talk about this or answer any questions that you may have. We can talk about any plastic surgery topic.
First question, do all the surgeons at your practice perform smart tuck?
Yeah, so there's something that we've developed, but now everyone is in tune with it. Everyone's been trained up. Everyone knows how to perform it. So yes, everyone in the practice, or Dr. Vidal, Dr. Woodruff, they're able to do this as well. So just make sure that either if you're already signed up for a mommy makeover or a tummy tuck, you can ask your coordinator about it. So you can kind of upgrade to that, or if you're inquiring with them just from the get-go, you can ask about it as well.
What BMI do you take?
So my max BMI is 30. So max BMI for me is 30. This does vary a little bit from surgeon to surgeon. I believe for Dr. Vidal, Dr. Wigger, it's a little bit higher at around 33.5. But yes, each one's going to have their criteria. My max BMI is 30.
Am I a candidate for BBL even if I have PCOS?
Yeah, so typically PCOS is not a contraindication for a BBL, okay? Now, of course, like everything we do, right, we got to make sure that we know all your past medical and surgical history. We got to know what medications you're on. We got to make sure that you have your medical clearance, et cetera, et cetera. But having said that, in and of itself, PCOS is not a contraindication. You can still get a BBL as long as everything else is okay.
How far out are your bookings?
So, I mean, guys, you kind of missed it. I'm booked through pretty much till like April now. Okay, so there may be a couple spots left in March. I think, I don't know, very few, one or two. But the next kind of big openings are in April. All right, so that's what I'm saying. First of all, we haven't even announced this yet, but we'll say it here today for all of you that have been so kind to join me on the live. But starting next year, 2026, prices are going to go up. Okay, so if you're thinking about surgery for next year, the time to book is now. Okay, you will never get a lower price than right now in 2025. In 2025, I mean, we're there, guys. We're like 3-4 weeks away, and we're done. Okay, so if you're thinking about surgery for next year, remember you can book up to a year out. If you're thinking about surgery anytime next year, the time to book is today.
Do you do the upside down heart shape on the booty?
I do. I like the question, but not only do I do it, I came up with it, right? It is my signature upside down heart shape. And so that is something actually that I've been doing for a while. I'm really, really good with that technique. And it's actually my favorite kind of shape, really, for the BBL, for the booty, because I think it creates a kind of a long-lasting, beautiful, enhanced natural result. And that tends to be also what people are going for nowadays. People are asking for kind of athletic looks, Pilates type looks, and things like that. And we're certainly able to deliver on that.
What about scoliosis? Am I able to get lipo and BBL?
You can, but you have to make sure, you just have to have realistic expectations, right? Because the one thing that we cannot change is the scoliosis itself, which is being caused by the curvature in the spine, right? So that's your underlying skeletal foundation. And scoliosis, by definition, is going to cause some asymmetries. So you may have a hip that's a bit higher than the other, right? Which means that you're going to have a waist that comes in more than the other. And you're going to have a hip that rounds out a little bit more than the other, right? So you're going to have these small asymmetries due to the scoliosis. And that's just part of the deal, right? It's just something that needs to be accepted. But otherwise, you're certainly a candidate, and it can be a huge change for you.
How to get a consultation, and is there a cost?
So that's why I put this up here. There we go. We get this question almost every single live. So the easiest way to, or the most straightforward way to get a consultation is to go to our website, which is www.pureplasticsurgery.com. And there you're gonna see like a banner or a button that says virtual consultation, right? Or you can see one that says how to get started. And with that, you'll be able to send us your information, your name, your email, your cell phone number. If you do the virtual consultation, you also can fill out a questionnaire and send us photos, and then we'll go over all of that, and then our coordinator will reach out to you. Okay. The cost for the virtual consultation, as I just described, is zero. Okay, no charge for the virtual consultation. Okay. Now, for those of you that want, a more kind of direct consultation with me, we can have the option of a video consult for those that are not from here in Miami, and that we can do a video consult, one-on-one. That will have a cost of $250. Or we can do an in-house consult where you actually come into the clinic and we spend a lot of time here together. Now that one has a cost of $500. Okay. Now these costs, and I put that in quotation marks, are not really costs, because once you book the surgery, that goes towards the surgery. So you're not paying like your surgery plus the consultation fee. The consultation fee goes towards your surgery.
Thank you. This question, I missed the first half, sorry. Do you lipo the entire back for Smart Tuck?
So not the entire back, like directly in the back, but we do the entire, all the sides, basically. So the entire flanks, waist, and the axilla, including the front of the axillary region here. So we have all the axillary region here, the entire side just beneath the arm, the sides and back, and we do get around to just about here. I don't know if you can see that on the video, but we do get around all the way to about here. So the only part that we're truly missing is kind of that central back area. But for that, I would have to kind of flip the patient, right? And I'm not going to do that through your typical tummy tuck or mommy makeover. And the only patients where we can consider doing the entire back as well, so kind of in addition to your Smart Tuck, would be for a lower BMI patient. So say someone that's BMI 25 or less, okay? And why is that? Because here in Florida, we do have a rule that's given to us by the Department of Health. And that rule is that when we're doing a tummy tuck, we can only remove 1,000 cc's of fat via liposuction, okay? And so for most patients, especially if their BMI is higher than 25, they're going to have a lot more than 1,000 cc's in the back plus the flank areas, okay? So that's why we have to kind of, do things under the regulations of the Florida Department of Health.
I just had my phone consultation today. Can't wait to get my journey started.
Yes, that's awesome. All right, love to hear it. Looking forward to it.
Next question, how to correct a dent after BBL?
All right, that's a good question, because it's not a straightforward answer, because there can be different reasons for a dent, okay? What do I mean by that? Well, we can put them in two categories. Is the dent being caused by lack of volume, or is the dent being caused by banding on the inside? Okay, so for example, if you have a dent typically caused by cellulite, that's going to be caused by a band or a septa that basically is attaching the skin to the underlying muscle and pulling the skin down. Okay, so cellulite is a common cause for dents that are caused by banding. Another common cause for dents that are caused by banding is scar tissue. Maybe there was prior injection to the area, like a vaccine when you were a baby, or prior trauma, or maybe just genetically you have some bands there, right? So in order to fix those dents, we got to cut the bands. And the easiest or best ways to do that is using a device called Obeli. And so that device has like a little knife at the end of it that's able to cut the bands and allow the skin, which is dented in, to pop back out. Now, of course, if there's a different cause for the dent is due to a lack of volume, then the best way to fill that is with either your own fat, which is probably the first option, or if it's a small area and you don't have any fat left, we can use aloclay, which is that off-the-shelf fat that we have now.
Is it normal to have loose skin after a tummy tuck only when I sit and bend, not when I stand?
Yeah, of course. You're going to have some degree of skin laxity when you're all bent down and sitting like this, right? Because if not, then you wouldn't be able to stand, right? So it's not unusual to have some degree of looseness to the skin when you're bending, like really, really bending or sitting. But when you're standing, yeah, there shouldn't be any skin laxity there. It should be fairly tight, fairly taut.
How long after surgery would I have to stay local before going home?
So you would have to stay here a minimum of 5 days after surgery. Okay, that is the absolute minimum. You should not and could not leave before the 5 days. If you do, you're risking major complications. You're risking your life, and you're leaving what we call against medical advice. Okay, so just don't do it. If you plan to come for surgery, remember you're going to stay here for at least 5 days. All right. And why? What's the most important reason? Is because we want to minimize any risk of blood clots. That's really the major concern there.
Are diabetics high risk? Are diabetics high risk with? She's 5'7", 160 pounds.
So being a diabetic in and of itself does not make you high risk. That's the good news. Now, what do we have to do? We got to check some special things, right? First of all, of course, we'll get a medical clearance from your doctor. We got to make sure that you don't have any major other issues going on, like with your heart or your lungs. And then we're going to check a lab. And if you're a diabetic, you probably know about this lab. It's called the hemoglobin A1C. Okay. And so we're going to check that lab to make sure that your sugar levels have been fairly stable. We typically like to see a hemoglobin A1C of 6.5 or less. Okay. And if you have that lab and everything looks good and you have your clearances and everything else, then boom, you're good to go.
Do you guys recommend Recovery House?
So we're not affiliated with, nor do we recommend any specific recovery home. Okay, we're not affiliated with them. What I can tell you is please do your research. Okay, there are many homes out there. Some of them are official and legit, and some of them are not. Okay, so what do we recommend? What can we recommend? We recommend staying in the hotel that we are affiliated with. Along with the post-op team that we are affiliated with. Okay, so that hotel is called the AC Hotel. It's literally less than 10 minutes from here, from Pure Plastic Surgery. And in that hotel, you can get taken care of by the Med Miami team, which is a spectacular post-op team. And so that is our recommendation. Not only that, but you could also get your massages from Jessica, Bestie Jeannie. She can go out there to your hotel as well. So basically, we include the entire package. You can get your hotel, your post-op care, your massages, and even your transportation. We provide transportation from the hotel to the clinic, back and forth as well. It's a great package. It eases the mind because you don't have to worry about all these things. We just take care of all of it for you. We take care of where you stay, who's going to take care of you post-op, your massages, your transportation. It's the best and easiest way to just take care of all that.
So with the Smart Tuck, you inject fat into the hips. The question is,
yes.
How many cc's without a tummy tuck?
How many cc's?
I'm not sure I understand.
Yeah, but let's just answer the question about cc's, right? So when you do a tummy tuck here in Florida, okay, like I said before, the maximum amount of fat that you're able to remove via liposuction is 1,000 cc's, right? So therefore, the maximum amount of fat that I can transfer to the hips is going to be about 500 cc's per side. Now, typically that is more than enough. Okay, that is more than enough to create that nice, beautiful curve without going too crazy or exaggerated. We create that beautiful, Pilates look, athletic look, enhanced natural look, maybe even a soft Vixen look. But we're not going to go with like the big, Vixen look with that.
Thank you. Next question. Can you provide a letter for patients who need a visa to get to you?
Oh boy, I don't know that we've done that, but yeah, we'd love to do that. If you need a visa and you need a letter from us, just let us know. and we'll write whatever you need. You tell us what you need us to put in the letter, we'll write that for you so you can get that visa, and we'd love to see you here.
Are your follow-ups virtual or in person only?
It's both. We have a combination of both. So it's really what's most convenient for you, right? I'll say this: the first follow-up, which is on day one, so the day after surgery, we tend to do that virtual because we've learned over the past 7 years that for patients to get up, get in the car, come to the clinic on their first day after surgery, it takes a toll on them. It's super tough. And so we don't want to do that. And so we're going to do that first day one. We're just going to do that virtual. We're going to talk on the video. We're going to have you send your photos and everything else. And we just take care of it that way. And that way you're in your home or hotel, wherever you're staying, and you're nice and comfortable and you don't have to move around a ton. Okay. But your post-op day 5 visit, though, that's going to be in person. That one has to be in person because I want to see you here in person and kind of physically, see you and do the exam. And then the next follow-ups can be either virtual or in person. That's totally depending on you. We'll do whatever you want. If you want your 6 weeks to be virtual, we can do it virtual. If you want your 6 weeks to be in person, we can do that too. And then we do that one at 3 months as well. Whatever's best and most convenient for you.
I'm scared to do a BBL because I'm afraid that my love handles might get in the way of my butt. My love handles make the top of my butt look flat.
Well, if that's what you're scared of, that's the entire reason to do the BBL, right? I would say then you're probably a perfect candidate for a BBL because if that's what's happening with you, I'm gonna tell you right now, and there may be some those exercise people out there, but you can kill yourself at the gym, and you're not gonna change that shape. You're just not gonna be able to do it. Okay, the only way that you're gonna be able to change that is with a BBL. Okay, so I always say that you should not be scared of the BBL. I think that's what actually makes you a good candidate for a BBL. And unfortunately, if you try something else and just diet and exercise, it's not gonna work.
How to get a nice butt cuff, heart-shaped butt. What can I do to help achieve that?
Right. So what we can do and do BBL is create the shape. Right. We can create that nice kind of upside down heart shape. Okay. And that's because we can fill here, we can fill, and we can reduce the waist and create a nice upside down heart shape. Now, when people talk about the cuff, a lot of times we're referring to that what we call the infragluteal crease, which is the crease that's at the lower end of the buttock, which is the crease that divides the buttock with the thigh. The one thing, though, all of you should know is that the crease itself is something that we cannot change. I cannot make this crease like deeper or less deep. I cannot make it longer or shorter. I cannot move it up or down. Your crease is your crease. That's it. Nothing we can do about that. However, if you want more, say for example, you want more volume in the lower part of the buttock, of course we can do that, and of course we can create that nice upside down heart shape for you as well.
Do you do armpit tucks?
So armpit tucks is typically, some people call it an armpit tuck, some people call it a mini brachioplasty, or it depends on what we're doing. But yeah, bottom line is we can do something that's going to help with any excess skin in the armpit area or in the kind of the arm in this area here.
Would I need blood work in the USA, or can I use my Canadian blood work report?
So a lot of times we do need to. We need both. We need for you to send your Canadian blood work so that we can just make sure everything's okay, because we don't want you to have to travel all the way down to Florida and then find out there's an issue. But a lot of times we then kind of just repeat your blood work here just so we have that. It's basically for our files because it's something that's required by the Florida Department of Health, but it's something that we can take care of for you, okay? We can take care of all that for you. So it's going to be easy peasy, and we have a place here that's super cheap as well.
I've had 2 liposuctions before and 1 BBL. Can I go for a second round BBL with you?
Wow. So that means it's basically your 4th round of lipos. You got 2 lipos and a BBL, and you're talking about the 4th round. So I'm going to have to take this very much on a case-by-case basis, right? I would ask you to go ahead, fill out the form, fill out the questionnaire, send your photos. I can take a look at everything to see if you would be a candidate for another round of liposuction, right? Every time we do liposuction, it's kind of the rule of diminishing marginal returns, right? If you never had liposuction, then of course you're definitely a candidate. There's not going to be a lot of scar tissue or fibrosis or anything else going on. Second rounds are very, very common, super common. A lot of people doing second rounds. Now, once we start getting into third and fourth rounds, now we have to really think about what's been done before, how much scar tissue is there fibrosis, right? All these things kind of come into play.
How soon after surgery should your massages be?
Very soon. It should be the next day. So the day after your liposuction or any of these, right, tummy tuck or BBL, you're going to start at the next day with your first massage. So that's post-op day 1. And then you're going to have the first 5 to 7 massages are going to be daily after that.
Can we get an additional area of lipo or switch out one of the areas with the Smart Tuck? Let's say we recently got lipo and just want a bra strap lipo with the Smart Tuck.
Sure. So switching out works, right? For the same reason that I said before, right? One of the reasons that we just can't or shouldn't be doing like a whole lipo 360 with the tummy tuck is we're not allowed to here in Florida. Now, that doesn't mean that everybody follows the rules, right? But do you want to go to a surgeon that doesn't follow the rules? I don't know. I would ask myself, what other rules are they not following? Are they actually being safe? Or are they not going with the safety measures that the Department of Health is telling us to do? Right? You got to question that. But if you want to switch it out, then sure, because that means we're not removing from one place and we're removing from another, and we're still reaching that volume limit of the 1,000 cc's.
What makes a patient high risk?
So it's going to be typically a medical condition, right? Their past medical history, potentially their past surgical history, their past sometimes psychiatric history, right? All of these things could potentially make a patient a high risk. So, for example, if they have diabetes that is not controlled, so uncontrolled diabetes, uncontrolled blood pressure, history of blood clots, history of issues with the heart attacks, stuff like that. A major psychiatric condition that is not controlled, like schizophrenia or bipolar disorder, or even body dysmorphic disorder. That's something that we really have to think about a lot in plastic surgery. So there can be several reasons or factors that may make you not a candidate. Or say, for example, hemoglobin level. You have a hemoglobin level that's under 12 and you just can't get it up because you have anemia or other issues going on, right? So remember, this is completely elective aesthetic surgery, right? This is not an emergency. And so we have to make sure that the candidate is a healthy candidate first and foremost.
All right, we got a 2-part question.
Yeah.
I just got a lipo 360 and BBL. How can I sleep? And then the second part is, she got 800 cc's transferred. Is that a lot of volume?
Okay. So let me answer the second question first. 800 transferred, is it a lot of volume? It depends, right? Because that's going to depend on the patient. For example, I don't know you, and I don't know your BMI, but say you're 4'11", 110 pounds, or well, you probably wouldn't, I don't know, whatever, 120 pounds. 800 is going to be a big change for you, right? Say now you're the opposite, and you're 5 foot. Is more of a modest change, right? It's gonna vary a lot depending on your height, your weight, your body composition, etc., etc. So and that's not it's not as straightforward. Now, how are you gonna sleep? I ask all my patients to sleep on their tummies, right? So you want to sleep face down, so you're putting zero pressure on the hips and the buttock. And I ask you to do that for the first 6 weeks. And that's how most patients are able to do it. However, there are a few patients that just don't tolerate that. They don't tolerate sleeping on their bellies. Sometimes it hurts their neck. Sometimes they get headaches. Sometimes they just don't sleep. So for those patients, I have them use a special mattress. You can get a special BBL mattress, has like a cutout in the middle, so that we or a special chair as well.
I'm 25 with no kids, tight skin. Is lipo good for me?
You sound, based on what you're saying, you sound like a perfect candidate for lipo, right? You're young, you have healthy skin, it has never been like fully stretched out in the past, there's been no pregnancies. I guess the only other question I was asking, have you gone through any big weight fluctuations? But if the answer is no to that as well, then yeah, it sounds like you'd be a great candidate for liposuction.
Do you do a wake lipo for small areas like flanks?
I typically, for the most part, I do not do a wake lipo. For the most part, I do all my lipo under general anesthesia. I actually think, and not only think, but research, show. I actually think it's the safest way to do liposuction. Okay, because when you do it under general anesthesia, you do not have to use lidocaine. Lidocaine is a numbing medication. When you do a wake lipo, you have to use lidocaine, and there is such a thing as lidocaine toxicity, right? Like using too much lidocaine, which can lead to heart issues and neurological issues such as seizures. Now, if we're talking about a very small area, say the chin, right? Or say someone who's coming back just wants to have a little tiny area fixed, then we can do that under local, okay? But for the most part, I do almost all my liposuction under general anesthesia.
All right. Is the mommy makeover a BBL, tummy tuck, and lipo?
No, not typically, not in the way that I describe it for us, and I think for most people, a mommy makeover is the combination of a breast surgery and a tummy tuck. And now you can combine that with your smart tuck. So you can have your breast surgery and your smart tuck. The breast surgery can be whatever you need, so anywhere from a breast aug to breast lift with or without implants, breast reduction. And then, of course, if you'd like, we can add the smart tuck to that with everything that we talked about here.
So the next question, I think this pertains because she had the BBL. She asked how she should sleep. She said, how long does the inflammation last? How can I prevent it?
So unfortunately, you can't prevent it completely, right? Because you've had surgery. And so your body's gone through what we like to call the trauma of surgery, and you're definitely going to have inflammation, 100%. There's no way to have a big surgery like a Lipo 360 plus BBL and not have inflammation, okay? So what can you do to try to minimize it? Yeah, there are certain things that we can do to minimize it. Walking is like the number one thing. I expect all my patients to be up and walking at least 10 minutes every hour while awake. That helps your body reduce inflammation. Number two, after 48 hours, if you want to take an anti-inflammatory such as ibuprofen, that could help as well. And then diet, right? You don't want to have too much salt in your diet. You want to minimize, excessive salts in the diet because that's going to help as well. How long is it going to take? At least 3 months. It's going to be minimum 3 months. That's minimum. Some patients, it could take longer, I think anywhere between 3 to 9 months, okay? But certainly not less than 3 months.
All right, we're at 32 minutes. We could just
32. Oh.
Yeah, that goes quick.
All right.
We can take a couple more questions. Do all tummy tucks automatically come with muscle repair?
Yes. So it's part of the deal. Now, if you're someone who says like I don't want it, of course we don't have to do it if you don't want it. But yes, it is part of the deal. And honestly, most patients do need it.
Let's see. Next question. Does the doctor do BBL reduction / correction?
Yes, actually, we're one of the biggest centers for that. So we're known for that because not a lot of people do these procedures because they are challenging procedures. And so we do BBL. I like to call it a BBL reshaping and reduction, right? Depending on what you need. For the most part, most people need more of the reshaping part of it than the actual reduction part of it. But it's a combination of both. These can be challenging cases. And so you need to go to someone who has a lot of experience doing this, which fortunately we do here.
Where are you located?
So we are in Miami, Florida, but we take patients from pretty much the entire United States. We got to check this again because the last time we checked, we had hit 49 states and we're missing one. And I want to know if we've hit all 50 by now.
Yeah, I want to know which state.
Yeah, we got to go back. But pretty much, we're talking like including Hawaii, right? People come to us from Hawaii all the time. And then, of course, we have international patients. Canada is probably the country where most people, where we have the most international patients coming from, but the UK is probably number 2. And of course, we have people come as far away as Australia and even like Ghana and Nigeria and Africa as well. So people coming from all over the world. So no worries. Like we know how to take care of you if you're not from Miami.
Can you do a reverse tummy tuck and a rest lift in one?
Probably a breast lift.
Breast lift, yeah.
Yeah, definitely. That's something you can combine for sure. And it's actually a good combination because it uses kind of the same incision. So when you do a reverse tummy tuck, you're pulling the tummy up this way as opposed to down that way with the regular tummy tuck. So we pull the tummy up this way, and so we tuck that incision into that breast crease, what's called the inframammary fold, or the IMF. So we tuck it into there, and also when you're doing a breast lift, you tuck that incision into there. So actually, it's a great combination.
The next question, should you wait until after you're done having kids to get a BBL?
I mean, that would be the most ideal if you already kind of have that all planned out. What I can tell you is that if you're having kids, especially more than one, a lot of times you have to think about maybe you need a tummy tuck first, right? Maybe you need that tummy tuck first to really take care of the excess skin and the muscles, and then come back at 3 months later and do your BBL. Okay?
All right. Let's do 2 more questions.
All right. Dos más.
Let's see. How soon after a BBL can someone get a revision?
So I typically don't like to do that before 9 months. So you typically want to wait at least 9 months, maybe ideally a year, to make sure, like we talked about before, to make sure that all the inflammation's gone, that things have softened up again, that we have the least amount of scarring to have to deal with. So for all those reasons, we do want to wait typically at least 9 months.
Oh man, we got a lot of questions rolling in, so I'm sorry if we can't get to them all.
Well, that's good though. I like the excitement.
Yeah.
So typically, what we'll try to do is to just let you guys know exactly what time it's going to be, so you guys can show up on time and give us flood us with questions. I'm happy to answer them all. But we usually do this for about 30 to maybe 40 minutes, right? Yeah. But it's going to be every hump day, every Wednesday. Okay.
How long does it take for skin to reattach after Lipo 360?
So it takes at least 3 months, which is why we have you in a garment, in a faja type garment, for at least 3 months, right? So the first 6 weeks are a little bit more intense. You're going to be wearing that faja with foams, potentially boards as well, night and day. And then you're going to do, once that's done, then you're going to do an additional 6 weeks wearing the faja 12 hours a day. Okay? So that takes you to 12 weeks total, which is about 3 months.
Okay, all right, let's do 2 more. Sorry.
Okay.
There's so many. Let's see. This is interesting. Why do the tummy tucks in Colombia seem like they're more contouring and they have abs more defined?
Yeah. So that and for the most part, I actually agree with you. But that's why you want to go to someone that kind of knows how to do that style, and that's where something like this comes in, right? And I've actually gone to Colombia. I've trained with some of the best surgeons out there. Some people would say he is the best surgeon out there, Dr. Alfredo Hoyos, and I've done several courses with him that have included, high definition liposuction, tummy tucks, and even rib remodeling, right? Which is what we're doing. We do that here now, pure plastic surgery as well. And so, yes, so all those techniques that we've learned, all those techniques. So that's why, like I was saying at the very beginning, we don't create that standard, straight kind of grandma tummy tuck. No way. That's not what we do here. We're gonna create that nice, beautifully contoured, curved tummy tuck. And like I said, and if you wanted to add some etching, actually, that is part of this as well. I forgot about that.
Yeah.
But yes, we can do HD with this as well. So some high definition can be a part of your smart tuck if you want it.
All right, last question. I have a pouch from a previous C-section. Can I still do a reverse tummy tuck?
No, I mean, if the problem is near the C-section, right? So it's below the belly button, then the solution is going to be below the belly button. So depending if it's just skin or you have something else going on, you may be more of a candidate for a mini tummy tuck, right? To fix that area down there. Now, what I have seen, if you're someone that says, say you have excess skin below the belly button and some excess skin above, but no issues with the muscles, which would be rare after having children, okay? But in that rare circumstance, you can combine a mini tummy tuck with a reverse tummy tuck to address both issues. But honestly, for the most part, if you've had kids, right, you've been through pregnancy, one or multiple pregnancies, you're going to have problems with the muscle as well. And so the best thing to do is just do your regular tummy tuck, which will address the skin above and below the belly button and the muscle repair.
Thank you so much.
Okay. All right, everybody. I love the engagement here today. So remember, we are here every Wednesday on Hump Day with Dr. Alex Earle. We'll let you guys know what time, so make sure you bring your questions. And the final Hump Day of 2025 is going to be December 17th. I believe that's the Wednesday. So December 17th is going to be the final Hump Day live of 2025. So keep that in mind. All right. All right, everybody. I'll catch y'all later. Take care.